All right, so you're ready to jump into the world of medical technology. I bet that interview is right around the corner, huh? Well, today we're going deep on acing that medical technician interview using some really helpful info from Indeed.com.
Yeah, and we're not just going to scratch the surface here. We're going to really break down those common questions. Figure out what those interviewers are really trying to find out, and we'll give you the tools to really make yourself stand out. Consider this your little secret weapon, your cheat sheet for interview success.
Love that, a cheat sheet.
Oh,
Okay, so Indeed.com says employers are looking for three main things, right? Technical skills, obvi, real-world experience, and being able to work on a team. Seems kind of basic, but how do we make those things really pop in an interview?
The key is to show them, not just talk about them. Anyone can say, "Oh, I'm a team player," but interviewers, they want to see it. Think back to a time when you were working on a project, maybe even a tough one, and you were a great team member. Or did you have to fix some kind of tricky problem at a past job? Those stories, those are gold.
Okay, yeah, bringing those experiences to life. I like that. Now, Indeed.com has a ton of sample questions, but let's zero in on the ones that give us a deeper look into this whole thing. One that jumped out at me was, how would you handle a disagreement with a coworker? They say to calmly listen to them, try to see their side of things, and then explain yours respectfully. And if you just can't agree, get your supervisor involved. Makes sense, I guess.
It does, but there's a little more to it than that. It's not about never disagreeing, right? It's more about showing that you can handle conflict in a professional way. Think about it, healthcare, that's a high stakes environment. So imagine there's a situation in the lab where the results of a test don't match up. You've got to be able to speak up, respectfully, but you've also got to be open to what other people are seeing too.
So it's about being assertive, but also being a good listener, especially when you're dealing with patients. All right, next question is a classic. Why did you decide to become a medical technician? The sample answer focuses on a passion for healthcare and how it impacts people's lives.
That one's all about being genuine. You don't need some crazy backstory, just a real connection to the field. What is it about medical technology that gets you excited? Is it figuring out problems, getting to use cool new equipment, or maybe it's knowing that you're directly helping patients get better? Just let that passion show.
I can already feel myself getting more confident. All right, let's get into the technical stuff. Can you describe a time you had to troubleshoot a technical issue? The example they give is about a diagnostic machine that broke down during a really busy time. They, looked at the problem, checked the manual, found the part that wasn't working, and swapped it out.
This question is about more than just fixing a machine. It's about showing you can think critically when things get stressful. So think about the equipment you're going to be using every day. What if the blood analyzer starts acting up? Or the centrifuge throws an error code? They want to know you can handle those situations calmly, quickly and efficiently, especially when time is really important.
So maybe mention the specific equipment you know and how you would approach troubleshooting, right? Details are important.
Mhm.
Okay, this next one is about owning up to your mistakes, which feels like a huge deal in healthcare. How would you handle a mistake you made during testing? The sample answer says to take action right away. Tell your supervisor, fix the mistake if you can, and then figure out how to stop it from happening again.
Yeah, this one's all about your integrity. We all mess up sometimes, right? But it's what you do about it that matters. Let's say you accidentally mix up two patient samples. How do you make sure the right results get to the right people? Interviewers, they want to see that you're really committed to being accurate and keeping patients safe, and that you're always learning and trying to be better.
It's all about taking responsibility and using those mistakes to grow. Really important stuff. Okay, let's shift gears a bit and talk about you. What do you consider your greatest strength? They say to highlight attention to detail, which makes sense because being accurate is super important in this job. But how do we make this answer really stand out from the crowd?
It's all about connecting that strength, to what it actually means to be a medical technician. Like maybe you're really careful when you're calibrating equipment, or maybe you're really good at spotting those little mistakes in lab results. Whatever it is, you got to give them a real example. Don't just say, I'm detail oriented. Say something like, I'm detail oriented, like that time I caught a labeling error that could have messed up a patient's treatment.
Right, right. Adding that context makes all the difference. Like you're painting a picture for them. Okay, speaking of staying on top of things, the article asks, how do you keep up with the latest advancements in your field? And they mention like professional training, webinars, those publications, and those online forums.
Yeah, but this question, it's about more than just, checking off boxes. It's about showing that you're really dedicated to learning and growing. Because medical technology, it's always changing. There are always new tools and techniques coming out. So they want to know that you're not just going to be okay with how things are, but that you're excited to learn new things.
It's like showing them that you're not just a technician, but a real professional who's invested in their career, right?
Exactly. And don't just list off a bunch of resources, be specific. Was there a webinar you watched recently about some new PCR technique that you found really interesting? Are you following someone, like a thought leader in the field who's doing really cutting edge stuff in personalized medicine? Stuff like that shows that you're really paying attention to what's happening in the field.
Yeah, that makes a lot of sense. Okay, so Indeed.com has a bunch of other questions listed, and some of them seem a little cover, like, how do you prioritize your work when you've got a million things to do? Or, tell me about a time you found a mistake in lab results.
Those are the kinds of questions that are meant to see how organized you are, how you think critically, and how much you care about quality. And remember, in healthcare, those things, they're not just ideas, they have a real impact on patients. Imagine you've got a bunch of stat orders coming in all at once. How do you decide which tests need to be done first? That's the kind of problem solving they want to see.
So it's all about thinking quickly and making good decisions when things are hectic. Now, they also talk about using the STAR method to answer these questions. Can you break that down for us?
Sure. STAR, it stands for situation, task, action, and result. It's a way to tell a story that really highlights your skills. So you start by describing the situation you were in, then the task you had to do, then you talk about the action you took, and finally, the good result that came from it. It helps you to be clear and get your point across.
So instead of just saying, I'm good at prioritizing, you could say, when I had a ton of tests to do and a stat order came in, I looked at how urgent each sample was, talked to the doctor, and made sure the most important tests were done first. And that helped the patient get diagnosed quickly.
Exactly. It makes your skills come alive, it shows how they actually work in the real world. But while we're focusing on this Indeed.com article, there's something else that people often forget about when they're preparing for interviews.
Oh, I'm all ears. What's the secret weapon?
It's remembering that an interview is a two-way street. You're not just there to impress them, you're also there to see if this job is right for you.
It's easy to get so nervous that you forget you have choices, too.
Think about what you want in your career. Do you like working in a fast-paced environment, or do you prefer something more research-focused? What kind of boss do you work best with? Don't be afraid to ask them about the lab culture, if there are opportunities to learn and grow, or even what the team is like.
It's about finding a place where you can thrive, not just getting any job. But let's be honest, going into an interview can be really scary. What are your best tips for calming those pre-interview jitters and feeling more confident?
Well, I think the most important thing is to be prepared. When you've done your research on the company, you know what the job's all about, and you've practiced your answers using that STAR method, it really helps. And honestly, everyone gets nervous. It just means you care. It's so true. Think of it like a conversation, not like an interrogation.
Yeah.
You're showing them what you can do and what you're passionate about, but you're also figuring out if it's the right place for you. And even if this specific job doesn't work out, you learn something from every interview. It gets you closer to finding that perfect fit.
Couldn't have said it better myself.
Ah.
Now, before we finish up, I have one last thought that might help you really shine in that interview. Remember that question we talked about earlier? The one about challenges? Well, try to think of a time when you faced a real obstacle in a past job, maybe even back in school. How did you deal with it? And what did you learn from that experience?
I love that. I mean, we've all had those moments, right? And those stories can be really powerful. Imagine telling the interviewer about that time you had to learn a new piece of equipment super fast because a coworker was out sick. Or maybe about how you spotted a mistake in a lab procedure that could have been really serious. Yeah, exactly. It shows you can think on your feet, handle surprises, and that you really care about patient safety and doing things right. Those are qualities that any medical technician would be proud to have.
Absolutely. Wow, this deep dive has been amazing. We've gone from figuring out what employers are looking for to really breaking down those tough questions and even thinking about what we want in a job.
We've covered a lot, but at the end of the day, getting your dream job in medical technology isn't just about having the right answers. It's about passion, being prepared, and really wanting to make a difference in the field.
Well said. So to everyone out there getting ready for their interview, we hope you're feeling confident and ready to go.
You got this.
Good luck.